months and months ago that, of course, President Trump, in an interview with Chris Wallace, that will air tomorrow on Fox News Sunday. Some mixed messaging, though, on masks now taking place in one of the hotspots, Georgia. That's where the governor of the state, Brian Kemp, has suspended local mask mandates, and now the state is suing Atlanta Mayor Keisha Lance Bottoms, Atlanta, and the city council for continuing the mandate in the state's capital city. So how important are masks? Joining us now, Dr. Sarah McCool, who's clinical associate professor at the School for Public Health at Georgia State University. So, Professor, thanks for joining us. I mean, from a medical point of view, what do you think of this mask battle between, the governor and the mayor?
Well, from a public health point of view, the idea of a mask mandate may not be something that Americans generally embrace, because Americans in America is a very individualistic culture, meaning we prioritize doing what's best for the individual over what is best for the group. And collectivist cultures are the opposite. They do what's best for the group over what they believe is best for the individual. And so individualism in America is not a bad thing. And in fact, the protection of personal liberties is one of the things that makes America uniquely great. However, that individualistic view can become problematic when we're facing a common enemy like COVID, where it really requires us to prioritize what's best for the group over what's best for the individual.
So in that vein, what would be, in your view, best for the group?
In that vein, what's best for the group is really to wear masks. We know now that masks can provide protection against COVID for individuals wearing the mask and for others. And the messaging has shifted over time, and I know that that's something that can be very frustrating and tiring for the American public. But unfortunately, that's one of the drawbacks that happens when we have this new virus that we are learning about and continue to learn about in real time. And so the pendulum has really swung back and forth. First they were saying don't wear masks, then they were saying wear masks. And so the messaging has been really confusing. But based on what we know now, some of the best advice that we as public health professionals can give is to wear a mask.
Yeah, Dr. Fauci, early on was saying, you can go about your business, and we were told the CDC saying, well, you don't have to wear a mask, but obviously that changed. Here's Dr. Fauci just the other day talking about this very issue.
I would urge the leaders, the local political and other leaders in states and cities and towns to be as forceful as possible in getting your citizenry to wear masks. Masks are important as part of the physical distance. Physical distancing is the most important, but practically when you're living your life and trying to open up the country, you are going to come into contact with people. And for that reason, we know that masks are really important and we should be using them, everyone.
You see on social media videos of people going to the stores that don't want masks. They start screaming and yelling, or they get kicked out, or they call it one person called it Nazi America because apparently someone refused to wear a mask. What do you say to those people who some may be watching right now say, I'm not wearing a mask?
Well, I think that we can really frame this in a way that doesn't necessarily trample on personal freedom. So one, we can reframe the message and say that masks really protect you as an individual. And two, for those who feel that masks really take away that personal freedom and that personal choice, similar to what the Surgeon General said a couple of weeks ago, wearing masks are really going to help us get a lot of our freedoms back. We lost a lot of freedoms during the lockdown. We couldn't go to places that we normally went to. We couldn't do the things we wanted to do. And now we're seeing parents can't send their kids to school the way they want to. We can't travel to the places that we want to go to without restrictions. There's a lot of people who are suffering medically, emotionally, socially, and emotionally. And so the best way to really fight this and end this is to wear a mask so that this doesn't drag on for 2, 3, 4 years and we can really get back to our pre-COVID normal.
Yeah, the CDC is saying that if everyone in America wears a mask, that they think that the coronavirus could be under control in 4 to 8 weeks. Now, you got rural counties where there aren't many people around, and you've got packed cities, downtown Atlanta, or any city. Do you think that's possible? Is that too optimistic, or could that be realistic?
At this point, we don't know what we don't know, and I do think that there has been evidence that has shown that masks can be really effective. And so if everyone really joins in the fight together and is dedicated to trying to help end this, that wearing masks really could have a significant impact in a shorter time than I think we really anticipate.
Very quickly, we got some stats from Georgia, from your state where you're at. I mean, it's astounding. In just 3 months, as of yesterday, more than 14,647 people hospitalized, more than 3,000 deaths. Just 3 months ago, that was half. 6,790 cases, 1,600 deaths. There's the stats up on the screen right there. In 3 months, basically doubled. What do you anticipate, Doctor?
If we are not able to properly follow public health guidelines, wearing a mask and socially distancing, I don't particularly see the situation in the state getting much better.
That is a sad commentary. I certainly hope you can get it under control. Dr. Sarah McCool in Georgia this afternoon for us. Thanks so much, Doctor. And thank you for your insight.
Absolutely. Thank you.
Okay.